Hi, I want to talk to you today about something that I think is very important. I speak to my clients about this before any weight loss surgery that's done, but it's something that people seem to forget. And I think it's extremely important to understand. So, what I'm going to talk about today is symptoms that people get when they eat sweets, but sometimes they get when they eat other things. One is dumping and the other is low blood sugar. You need to understand when you have one or the other, just in case it's something that's significant. Okay, so first, I want to talk about dumping. Dumping is a situation where the stomach empties quickly into the intestine. So, whatever food is in the stomach dumps into the intestine. That's where the term came from. That can happen in somebody who's never had surgery, somebody who has normal anatomy. It's quite rare for that to happen. But the term was actually defined in people that had normal anatomy because after weight loss surgery, people who've had a sleeve or a bypass have a smaller stomach. There's a higher likelihood that the food will go through the stomach more quickly and end up into the intestine. You can have dumping if you have a gastric sleeve, but it's not as common as if you have a gastric bypass. Now, what happens is the food is emptied into the intestine quickly before it is properly digested. That irritates the small intestine, and the small intestine then tries to flush it out. To do that, what it does is it fills with water. Your intestine can fill with really a gallon of water pretty quickly. Now, where does that water come from? That water comes from your bloodstream. I mean, your blood volume goes down because the blood has to absorb water from your tissues, your arms, your muscles, or wherever to replace whatever it's putting into the intestine. So if you put in a couple of liters of fluid into the intestine very quickly, your total blood volume will go down, and the symptoms that you get initially will be lightheadedness, maybe some nausea, some palpitation. Those are symptoms from all this fluid going into your intestine and coming out of your bloodstream. So people will oftentimes get nausea very quickly, and dumping happens 20 to 30 minutes after surgery. It most often happens when people eat sweets because the sweets go through, they haven't been adequately digested, and the intestine really does not like concentrated sugar being dumped into it, and so it tries to flush it out. So people will get nausea, and then within a few minutes, they'll have to go to the bathroom. They'll get diarrhea if they ate a bowl of ice cream. Some people will get it with just eating one cookie. Some people don't get it at all. When people complain about it, ironically, it's the people that don't get it. They come to me and they say, "Hey, doc, I can eat any sweets I want. And I don't get dumping." And I say, "Well, that's okay. That's just something that's, going to warn you, don't eat this stuff, but you know not to eat it." And the fact is, the lap band didn't result in dumping. And a lot of people, at least a lot of my patients, were pretty successful with the lap band. So you don't need dumping to be successful. On the other hand, it is something that people will try to avoid if they do get it. And so they will eat less sweets, and that's helpful. Nobody needs to eat ice cream to survive or, peanut butter cookies or whatever. Although some of the time I think peanut butter cookies definitely help me survive, but not very often. So anyway, the dumping comes from generally eating sweets. It can come from eating any kind of carbohydrate, really. Uh, Anything that's high glycemic index, like mashed potatoes, certain types of pasta, certain types of breads, that type of thing, cake, that converts to sugar very quickly and can cause dumping. So remember, dumping is more nausea and then sometimes feeling a little queasy or lightheaded, and then could result in diarrhea. Okay. Very unpleasant. People don't want to get it. That's dumping. I've heard people tell me, I get vomiting, and that's not dumping. Vomiting is not dumping. Two totally different things. So I'm not going to talk about vomiting and what that means. I can talk about that in a different video. But dumping is something that results in nausea, sometimes some lightheadedness, and then follows with diarrhea. It occurs 20 to 30 minutes after eating. And so these are the symptoms, and that's what dumping is. Low blood sugar is also called hypoglycemia, and that's more significant. Low blood sugar will occur maybe 2 hours after eating. And the way low blood sugar occurs is you eat something, and then your pancreas releases a lot of insulin. And after a gastric bypass in particular, you release more insulin, and that helps bring your blood sugar down. That's one of the ways, or the main way, that the gastric bypass helps resolve diabetes. Okay. And incidentally, the hormone that's given off that causes the pancreas to release more insulin is GLP-1. Okay, so all these medications that are out there that are GLP-1 type of medications are sort of mimicking a gastric bypass. There's some problems with that, and I discussed that in one of my podcasts. But nevertheless, after eating, especially some sweets, the GLP-1 goes up, stimulates the pancreas. Pancreas might give off an excess amount of insulin. In other words, more insulin than you need to deal with the amount of blood, the amount of sugar in your blood. Okay. So when it does that, your blood sugar drops precipitously. It goes from, whatever the number is, it might be in the normal range even, but it drops quite low. Anytime your blood sugar drops rapidly to below 70, you statistically or medically speaking have hypoglycemia or low blood sugar. By the time the blood sugar gets down to 50, you're going to start to feel it mentally. You might feel lightheaded, weak, lethargic. You want to go to sleep, that kind of thing. I've seen cases where people's blood sugar drops down into the 20s. Okay. When that happens, they pass out. They become comatose. Okay. It happens a couple hours after a meal. Okay. This is rare. Thank God. It's quite rare. But the fact is, it occasionally happens. And there are warning signs that this type of thing is happening. You eat something, particularly sweets or pasta or some, cake or some sort of a high glycemic index food, and your blood sugar drops low. You can detect that because you feel lightheaded. You might feel sweaty. These are the symptoms of hypoglycemia. It might feel a little weak. You have to sit down. Pay attention to that. Okay, you can go to somebody who understands this stuff and get tested to see if that's occurring. But if it's occurring and you continue to have those symptoms, what you're doing is you're eating things that are causing the pancreas to give off more insulin. The more you do that, the more the pancreas becomes what I call the Schwarzenegger of pancreases. It gets really good at giving off insulin, and it gives off more and more insulin over time. This type of thing generally doesn't happen until several years after weight loss surgery. It can happen after a sleeve. It's more common to happen after a bypass, and it can happen to people under normal circumstances. I'm going to talk about it happening in patients that are taking GLP-1 medications. But the bottom line is, if you notice this type of thing happening, pay attention. It could indicate that you're having what's called hyperinsulinemic hypoglycemia, which means your insulin is going too high and your blood sugar is then dropping to a dangerously low level. If that's happening, you need to do some changes in your diet immediately, and that'll resolve the situation over time. However, if you let it continue, it can develop to a point where, you eat a meal, you're driving along down the 405, you black out, you crash your car, and you die. I mean, that's an extreme example, but I have had a patient that did exactly that. Thank God the patient didn't die, but he ended up in the intensive care unit for a long period of time. And this was a number of years ago. It's the only patient that had symptoms that severe. I've had a couple of other patients that had lightheadedness, felt weak, had to go to sleep. And I immediately move in, talk to them, we get testing, and we assess the situation and modify the diet accordingly so that it stops happening and the pancreas stops producing such an amount of excess insulin. So that is low blood sugar. So low blood sugar does not occur shortly after your surgery. It occurs several years after, usually 2 years or more after. Dumping can occur, right away after surgery. And it also happens within 20 minutes to 30 minutes of eating. So that's the difference between dumping and inappropriately low blood sugar after surgery or hypoglycemia after surgery. These two things are very important to be able to distinguish. You can resolve the dumping very quickly, okay, by making some simple dietary changes. The hypoglycemia, the low blood sugar, that's much more serious, and you need to see somebody about that and figure out how to deal with that in a way that prevents you from having any major problems. Okay, that's the difference between dumping and low blood sugar after surgery. I hope you got something from this, and have a great day.